Hi there, my name is Sharon Caravetta. I'm a nurse practitioner and I work in primary care. However, I also work in aesthetics as well. I've been doing Botox and fillers for about 7 years. And I have patients that come in all the time with questions, especially about Botox. And so I decided to put together this quick little introductory Botox 101 presentation. It's not for those Botox veterans out there. This is very introductory, and hopefully it will answer some of the questions that you may have about Botox and make you feel a little more comfortable with it. At the very end of the presentation, I have provided my email. So if there are questions that you have that didn't get addressed, feel free to shoot me an email and I will get to those. You can also book a consult with me in person. I see patients at Fusion Medical Center in Scottsdale. I hope you enjoy the presentation. So what is Botox? Botox is actually a medication that we inject into the muscles. It is a neurotoxin, and yes, it is related to the same botulism toxin that people have heard about that is related to food poisoning. However, this is completely different. It's highly purified, it's made in a controlled setting, and it has to meet FDA standards of quality in order to be able to be used. These are, again, FDA approved, and they are purified, and they are very safe when used by medical professionals who have been trained in their use. So Botox has been around the longest. So we have a lot more data on the effectiveness and safety of Botox. However, there are multiple neuromodulators on the market now, and they are all essentially derived from the same type of neurotoxin. So one could gather that they will be equally safe and effective. There are differences in dosing, so just be mindful of that when you're shopping around and comparing. So where do we inject Botox? Actually, we inject Botox into a lot of different areas. However, the 3 most common areas requested are going to be the forehead or frontalis muscle, the crow's feet or periorbital muscles, and the 11s or glabella muscle. Also of note, the FDA has approved these 3 areas as being the areas that are considered on-label use for using neurotoxins in order to diminish fine lines and wrinkles. First up, we're going to talk about the 11s, the glabella region. What's important to know about this area is that people can start to develop fine lines and wrinkles that start to be present even when they're not making a scowling face or an angry face. And as those lines start to develop, they can become actually pretty deep. It's a great idea to start treating that before that happens. As long as the lines are minimal, then you can usually resolve them pretty easily with Botox treatment. As they start to get more and more deep, it may require additional tactics in order to address that issue. So another thing I want you to note is that the amount of treatment per area can vary. It depends on the look that the person's wanting to go for. I have some people who really want to keep some movement in that area. They say, you know, when I look mad, I want to look mad. That way my kids know I'm mad. And then I have other people that are like, really, I don't want that muscle moving at all. I never want to look angry. I want that almost frozen out. So you can literally have patients that want it either way. And we're easily able to accommodate that. That average amount, I would say, that we put, I find, into the glabella is going to be anywhere between 15 to 30 units. And again, that is a small area, but it's a very strong area, especially for men. That area can be quite strong. And it's important to also note on these pictures for this one, as well as the next 2 coming up, I want you to note that in between Botox visits, even though the Botox does wear off, what you'll notice is that the before picture on the left compared to the before picture on treatment number 3, you'll see that even though the Botox is worn off and it's time for their next treatment, it didn't come back as strong. What that is muscle atrophy. So over time, when we keep treating muscles and we don't let them come all the way back to their full strength, those muscles do stay weaker and weaker. And this is an important component in staying up on your Botox. If you get it done once a year, you've let that muscle come back to full strength. So what you want to do is make sure that when the Botox starts to wear off and it's no longer there, you want to make sure that you get in and get that retreated so that we can start having some overall weakening of those muscles that are a little overly strong and creating those lines that we're trying to resolve. So the next area is the forehead, also called the frontalis muscle. What's important to note about this muscle is kind of depends. Some people have very large foreheads and some people have very tiny foreheads. And that makes a difference because we've got to be able to cover that whole space. So again, dosing can vary. This is just an average, but I would say on average anywhere from about 15 units to 25 units would be what I would expect to treat in a forehead. And again, that can be changed, whether the person wants a very strong, noticeable frozen appearance, or do they want to be able to keep some movement in their forehead? It really does vary on person to person and what you want. So that's why it's really important that you communicate this with your aesthetic provider so that they know your preferences and can help dose that accordingly and space it in a way that you're going to be able to be happy with your results. One thing that is important to notice for people who've never done Botox before, sometimes when you treat this area, you can have a sense of heaviness. It feels a little heavy when it starts to kick in. For this reason, for my people who are brand new to Botox, sometimes I'll do a baby Botox for this area just to make sure that they're not gonna be driving themselves crazy. The first time I had Botox put in my forehead and they went too heavy, even though it looked fine in the mirror, it really didn't feel good and it felt like my face didn't feel quite right. And so for that reason, I always tell people you can always add more Botox, but it doesn't hurt if you're a little bit nervous about changing the appearance of the lines in your face anywhere. It never hurts to do a baby Botox. So go light on it first and see how it looks. And then you can always add more later and have a better idea of what it's going to feel like. So I kind of feel like it's almost like Botox on training wheels sometimes to do those baby Botox, and then you can get comfortable with it. Again, you can notice that over time, those lines will start to appear less strong even when the Botox is worn off. And this is, again, because of muscle atrophy. And I feel like this happens pretty substantially in the forehead because even though it is a muscle that takes up a large space, it is actually a very thin muscle and it's not the strongest of muscles, but it can get expensive depending on the size of your forehead. So the next area is the crow's feet area. And this is going to be an area that can have a lot of variation in how much we treat because a lot of times people are looking for more prevention as opposed to working out the lines. And then also sometimes people will prefer to try to get a little bit of a lift to the eyebrow. And even though I will talk soon about how Botox does not lift anything, there is one way in which we get around that. And there are muscles around the eyes that are in a circular fashion. So the eye muscle is a circle. And what we can do is relax some of the part of the circle that is pulling the eyebrow in a downward fashion. This allows the muscles that bring the eyebrow upward to not have that opposing downward motion. And then it allows the eyebrows to actually lift. So we've talked a little bit about the ways that we use Botox on label, but there are a lot of ways that we can use Botox to enhance appearances and address other concerns that are off label. I will try to save most of that for maybe our Botox 202 presentation. But for now, just know that there are a lot of different applications, such as sweaty palms, sweaty feet, gummy smiles, raising eyebrows, and even neck lifts. So I've included this slide just to help give props to Botox. It has been around the longest and is used the most in the medical community outside of aesthetics. So I just like to put this out there for those people who, are not as familiar with Botox. It actually is used in a lot of medical applications and provides a lot of therapeutic benefits. It's used frequently with different types of muscle contractures and muscle spasms. It can help people with chronic conditions like cerebral palsy and help to address some of those issues that really there were not a lot of great treatment options before Botox. It can also be used to help correct lazy eye, and that is going to be something though that we wouldn't do in the aesthetic setting. So that's just for you to know. Ophthalmologists though can use this as an application to help correct lazy eye. It is used very frequently for migraine headaches, and they can really help for those people who have the chronic migraine headaches. That's not just for a headache here and there, but for the people who are struggling with difficult to control headaches. Botox can be a real lifesaver for those people. And additionally, it can be used in applications for bladder control. A lot of people may be suffering with issues of overactive bladder, and this actually can help resolve some issues of incontinence with that. So just to shed some light on other applications that Botox can do. And again, the other neurotoxins have not been around quite so long as Botox. So when you're looking in the medical community at what is being used more therapeutically, it actually would be Botox, whereas the other neurotoxins that we've discussed really are more so currently being used just in an aesthetic capacity. So Botox really is an awesome medication. It can help us in the world of medicine and in aesthetics. And even though it is amazing and I love working with it, it is important to remember that Botox is medicine, not magic. Botox only can relax muscles. As we've talked about, it's a neurotoxin. That means that the muscles can be weakened or completely relaxed with this medication only for a temporary amount of time. There are a lot of times I have patients coming in requesting different things for aesthetic appearance changes. And what they're actually asking for is not in the world of Botox. These are going to be things like lifting areas. I did talk a little bit about how we can make something have a little bit of lift. That is only if there is actually a muscle that is pulling downward. And then that way we can relax the downward pulling muscle and allow a little bit of a lift. But by itself, if you put a saggy muscle with saggy skin and you make it weaker, it's just going to create more sag. So just understand it is not always the right answer for when you're trying to make an area look a little more aesthetically pleasing. Also, it is not filler. So I get a lot of requests for people to put Botox into areas that actually have a deficit of volume. They have volume loss over time. And what they have to have at that point is a filler and not Botox, because relaxing muscles in an empty space isn't going to make that area improved and can actually cause an area to look worse, because then you're going to have even less movement there. And that skin, if there's laxity to it, it can actually make it a little bit worse because it looks more saggy. So it's really important to talk about your concerns and what your goal is with your provider so that we can make sure that Botox or another neurotoxin is exactly what you're looking for the look that you're going for. Also, one of the most common things that I see is that people come in with issues with skin texture. And especially here in Arizona, we have a lot of people with sun-damaged skin, and they come in with hopes that Botox can help improve their texture. Botox cannot address texture. That's something that we would have to address with a good skincare regimen, maybe some RF microneedling or lasers. Peels and so forth. But Botox is not always the answer, unfortunately. So I get asked this question a lot. How long can I expect my Botox to last? Well, it varies. Just like everybody's metabolism is different, your longevity of your Botox will also vary. Some people on average will find that it lasts between 4 to 5 months. Some people may be a little sooner and some a little bit later. It does wear off in the lips a little faster, but this is also a very affordable area to treat. Some people may find that one product lasts longer for them than others, especially if perhaps they have used one product for a very long time. It may be beneficial to switch it up and try one of the other neuromodulators.